Alright, good day guys, welcome to my channel. This is Dr. Paraman channel, a go-to destination for orthopedic insights and practical knowledge skills. Last lecture I discussed vividly on the stages of bone healing, where I talked about the three stages, three different phases as far as bone healing is concerned. I talked about the stages of hematoma, inflammation, and other things. And I talked about reparative stage, and I talked about bone remodeling stage. So today, I am going to be talking about the practical steps that is necessary as far as POP and other casting material application is concerned. So today, I'm going to be giving some steps in the management of fractures as far as conservative management is concerned. What are the steps if there's a fracture and the fracture has to be managed conservatively through the use of POP, through the use of scotch cast and other casting materials? What are the steps in application as an individual that want to know more about this practical thing, or that want to know more about this? How are we going to immobilize this fracture? How are we going to apply this? So you're on the right path. All right, so the first step in applying plaster of Paris as a conservative method of holding fracture. So the first one is to gather equipment. Generally, gather equipment that is necessary, gather materials that is necessary. You view everything that will be needed. Okay, I will be in need of water. There will be need for bowl and all other things, plaster of Paris materials, the stockiness, everything you're going to be using. So first thing is just to get the preparation done before you start the application. All right, so having done this, the next thing to do is examination. I mean physical examination. When we talk about physical examination, what are we talking about? Well, you assess your patient. What are the things that you need to get on your patient? You want to cast a limb, a particularly late step, for instance, now bones in the upper limb, in one of the long bones in the upper limb, which is ulnar. Let's say, for instance, that ulnar, but you want to cast it. The next thing to do as a technician or as a technology is to do physical examination by examining the nature of the bone you want to apply the cast on. What are the things that is there on the bone? Apart from fractures, there are many cases where the patient will be having injury, where the patient will be having bruises, where the patient will be having wounds on the same bone that is fractured. So these are the areas where you're going to examine the patient. You're going to check for any fiscal policy, whereas you are going to manage it conservatively. So the next one under that physical examination is to check for radiographs. The patient must have done X-ray for the fracture that has happened. So your own work is to check the X-ray, because it is the X-ray that will lead you to know what exactly you are going to deal with, the nature of the fracture, the patterns of the fracture, and how you are going to manage the fracture. So all this must be done under physical examination before you proceed to apply the cast. So having followed the physical examination, the next thing you are going to do is to do the positioning. You position your patient. You get him well seated or get her well seated. If it is fracture of the upper limb, the patient should be in sitting position. If the patient is not unconscious, he or she should be in sitting position. Then if it is lower limb fracture management, the patient should be in lying position. Then if it is the body aspect, the trunk aspect, the patient should always also be in sitting position, apart from e-spiker and other casts that requires more people. Now, in the application of casts, there are casts that may require you getting an assistant, and there are some casts that may require you not getting an assistant. So most of upper limb cast application may not require an assistant. In case you are in a geographical area where there is no assistant, or where you could not afford some, so you can actually apply some cast without assistance, whereby some casts even need more than one assistance. Let me take for instance, you want to apply a cast for upper limb, lower forearm. Now the position of the limb is going to be placed something like this. So if the patient places the position like this, you want to apply a POP cast from this edge to this edge. So the patient can position the limb like this, just in case you don't have any assistance. So if there's assistance, like I said, concerning the positioning, the hand should be like this, 90-degree flexion plus pronation. That should be the position of the hand. So having positioned the patient for the cast so as not to get your patient inconvenienced before during and after the cast application. So when you are done with this, you proceed by applying the stockinette. If this is available, you apply stockinette that will be applied to the particular limb, and you will leave 3 to 4 centimeter. You will leave edges 3 to 4 centimeter so that you can be able to turn back the stockinette when you are done with the cast. So if that one is available, you are going to use it. If it's not available, then you are okay. Go on with the padding. Once you have positioned the patient and you secured your assistance, you go on with the padding. What are the padding? Padding is the act of making sure the limb of your patient is well protected before the invention of plaster of Paris on that particular limb. So one of the padding material we have that we use most of the time is called autobahn. So autobahn is the one that you use to apply to protect your patient from one end to one end. So when we talk about this, the positioning of how you apply your autobahn, let's say for instance the one I said the other time, you are applying it to this kind of limb. The padding must start beneath the metacarpophalangeal joint, then you extend the cast just before the elbow joint, just 2 centimeters before the elbow joint. You stop the cast. The first thing you are to do under the padding, you make sure your autobahn application has to be 50-50. So you cover the 50% of the previous turn. They have to be even, because if one place is bulky or one place is wrinkled, it's going to affect the bones under it. There will be pressure on the bone. And make sure, in case you want to apply a cast that will be above elbow, most of the times when you get to the elbow joint, if you apply the same form like 50-50 round, when you get to this place, there will be wrinkled. The autobahn will be turning, it will be squeezing, and it is possible for it to compress some bony problems. I will talk about bony problems later. So when you get to this place, you make sure you apply it in form of figure 8. So when you get to the elbow joint, or you get to any form of the joint, for you to prevent the back padding from being wrinkly, so you have to make it figure 8. You apply figure 8. When you are done with the padding, you are okay. Then you proceed with application. You apply your POP, you take your plaster of Paris, you put it inside the water, you leave a wing few inches. What I mean by a wing few inches is when you take your plaster of Paris, you have to unroll little part of it, and throw it inside water. Because if you throw the whole plaster of Paris inside water, when you remove it, it will be very hard for you to notice or take where the edge starts from. So to avoid this, unroll few inches, then put it inside the water. When you put it inside the water, what you will notice is that you start noticing the bubbles coming up. When you notice the bubbles coming up, just leave it, don't take it yet. When the bubbles cease to rise, when the bubbles stop, that means the POP has been soaked with water. Then you remove it out gently and squeeze at the center so that the excess water can be removed from the POP. Then you apply your POP directly on the limb you want to cast. Then when you are applying the POP should not be bulky. One place should not be more than the other place. And also, when you get to the elbow joint, make sure you follow the principle of figure 8 pattern so that the POP, when it gets to elbow joints, will not be wrinkling. So that is how to apply. 50-50 also, let it be even. Don't let one side be bulky, don't let one side be more than the other side. Apply it with the help of your assistant. Your assistant will be there to make sure the limb is properly positioned. Like I said the other time, if you want to position a upper limb positioning, has to be done by placing the hand in 90-degree flexion. That is how to be done. So having done this, followed by the application, you mold very well. When you are done with the application, you mold with your palm. You mold with your palm so as for the cast to fit the contour you are trying to apply, and it will look more beautiful anyway. And if you use POP, it's going to be molded easily. If you use other materials that's not POP as well, it's going to be molded as well, but it may not be as easy as POP. So you are expected to mold the POP when you are done with the application, and not with the tip of your finger, just with your palm only. Because when you are exerting your tips of finger on the cast, it sustains the ability of causing more pressure or even causing more harm to yourself. So that will be done after the application. You mold, then followed by the cleaning. When you are done with the molding, you clean the patient, and you make sure at this edge that the plaster is not getting to the patient's skin, because when they are in contact for a longer time, during the mobilization, there has to be something that we call plaster sore to happen, which can lead to ulceration on the patient's skin. So you clean your patient and you make sure the patient is clean. If you use stockinette, like I said the other time, that if stockinette is available, I said you must leave 3 to 4 inches available. Excess is 3 to 4. So when you are done with the application of POP, you turn back the stockinette if stockinette is used. In subsequent lectures, I'm going to come and lecture on the adequate pattern or the adequate way of using stockinette. So after the cleaning of the patient, you do repeat examination. What am I trying to say about examination? After the application, you check something, we call something capillary refill. You check the teeth of the patient, you check this place, something like this, and you press it. When you press it under normal thing, there will be whitish thing that will be formed when you press it. Under 0 is under 1 to 2 seconds, that should be replaced by the normal nature of that particular hand. If that thing fails to return from being whitish to the part of reddish that is there, that means there's a problem with the capillary. So that means your cast you have applied is too tight. So you have to remove the cast. So after that, you have your patient, if it's upper extremity, you have your patient to be doing some passive active exercises by moving the phalanges. If it's lower extremity as well, you have the patient to be moving his toes and everything. So these are the examinations you are going to do. Make sure your cast you have applied is not too tight. So next, after that, if the management you did on the patient is reduction of the fracture bone, you have to tell the patient to go for check-up X-ray to confirm whether the reduction you have done is actually correct or not. So after this, the last one that will be followed is patient education. You have to educate your patient. What are the things the patient is going to be doing when he or she gets home? You know, the patient casting is not part of his life before, or part of her life. So this is the new thing you are introducing to his body. It will feel unusual. So you have to give some explanation, some education, of which I'm going to be projecting after this lecture that you can just get and read through. So these are the steps that I've come to conclude under the management of POP, from the positioning, application, and every other thing you clean your patients. So this will be the end of the class. Feel free to go on the lectures again and just read through it and make sure you get what you are trying to get. So in my next lecture, I'll be talking about other things as far as management of orthopedic conservatively is concerned. So for guidance and mentorship, you can actually copy the number you have on your screen. Alright guys, that will be all for now. See you in the next lecture, and make sure you subscribe to this channel. Click on the subscription button, then click on the bell so as to get notified anytime lectures are dropped here, and make sure you share as well. See you in the next class.